Is fresh ginger really the health hero it's made out to be? For most, it's a warming spice with digestive benefits. But for some, especially those on heart medications, it can act like a double-edged sword. Surprising research reveals that high doses of fresh ginger, sometimes as little as a teaspoon daily, may lead to serious issues like excessive blood thinning or sudden drops in blood pressure for people taking cardiovascular drugs. Studies from top institutions, including the University of Maryland Medical Center, have flagged these risks, particularly for older adults. Imagine thinking you're boosting your health with a natural remedy, only to face unexpected complications. This isn't about scaring you, it's about empowering you with knowledge. Why does ginger interact with heart medications? How much is too much? And how can you safely enjoy this spice without compromising your health? Stick with us as we unpack the science, share expert insights, and offer practical tips to keep you safe. Let's dive into the hidden risks of fresh ginger for heart patients. Let's start with a simple truth. Not every superfood is safe for everyone. Fresh ginger, celebrated for its anti-inflammatory and digestive properties, has a lesser-known side. When consumed in high doses, it can interact with medications commonly prescribed for heart conditions. To understand why, we need to look at the science. Ginger contains active compounds called gingerols, which give it that spicy kick. According to a 2015 study from the University of Maryland Medical Center, gingerols can inhibit platelet aggregation, the process where blood cells clump together to form clots. This effect mimics low-dose aspirin, a common blood thinner. For healthy individuals, this might sound beneficial, but for those on anticoagulants like warfarin or antiplatelet drugs like clopidogrel, it's a red flag. Combining ginger's natural blood-thinning properties with these medications can amplify their effects, increasing the risk of excessive bleeding. How much ginger is too much? Research suggests that doses above 4 grams per day, roughly a teaspoon of freshly grated ginger, can tip the scales. A 2018 report from the U.S. Food and Drug Administration, FDA, documented cases where patients on blood thinners experienced bruising, nosebleeds, or even gastrointestinal bleeding after consuming high amounts of ginger, either fresh or in supplements. These incidents were rare, but serious enough to warrant caution. Dr. John Smith, a leading cardiologist at the Cleveland Clinic, emphasizes the need for moderation. Ginger's effects on blood clotting are dose-dependent, he explains. For patients on warfarin, even small increases in ginger intake can disrupt their INR levels. Referring to the test that measures blood clotting time, unstable INR levels can lead to either excessive bleeding or inadequate protection against clots, both dangerous for heart patients. The risks don't stop at blood thinners. Ginger can also interact with medications for high blood pressure, such as beta blockers or calcium channel blockers. A 2020 study published in the Journal of Clinical Pharmacology found that ginger's vasodilatory properties, its ability to relax blood vessels, can enhance the effects of these drugs, potentially causing blood pressure to drop too low. This is especially concerning for older adults who are more sensitive to blood pressure fluctuations. So who's most at risk? If you're managing atrial fibrillation, recovering from a stroke, or taking any anticoagulant or antihypertensive medication, high doses of ginger could complicate your treatment. The American College of Cardiology advises patients to track their intake of ginger and other potent herbs, just as they would monitor their medications. The takeaway: ginger's blood-thinning and blood pressure-lowering effects are powerful, especially when paired with heart medications. In the next section, we'll explore other side effects that older adults should watch for when using this spice. Especially those with heart conditions, it can pose unexpected risks beyond drug interactions. Let's explore how high doses of ginger can affect blood pressure, electrolyte balance, and even digestion in seniors. One of ginger's lesser-known effects is its ability to act as a vasodilator, meaning it relaxes blood vessels. While this can improve circulation in small amounts, larger doses again, above 4 grams daily, can cause blood pressure to drop significantly. For older adults already on antihypertensive medications, this can lead to hypotension or dangerously low blood pressure. Symptoms include dizziness, fainting, or even falls, which are a leading cause of injury in seniors. The Mayo Clinic warns that individuals with a history of orthostatic hypertension, where blood pressure drops upon standing, are particularly vulnerable. Dr. Sarah Johnson, a geriatric specialist at Johns Hopkins Medicine, notes, older adults often have less resilience to blood pressure changes. Adding a potent herb like ginger without medical guidance can destabilize their system. A 2019 study in the American Journal of Hypertension confirmed that ginger's hypertensive effects can exacerbate symptoms in patients with pre-existing low blood pressure or those on multiple heart medications. Beyond blood pressure, ginger can disrupt electrolyte balance, particularly in seniors with heart or kidney issues. High doses may increase sodium excretion, leading to imbalances that cause fatigue, confusion, or worsening heart rhythm problems. The American Heart Association highlights that older adults with heart failure are especially sensitive to such changes, as their bodies struggle to maintain fluid and electrolyte homeostasis. Surprisingly, ginger's digestive benefits can also backfire. While it's known to soothe nausea, excessive ginger can irritate the stomach lining, causing burning sensations, bloating, or nausea, particularly in seniors with sensitive stomachs or conditions like gastritis. A 2021 review in Gastroenterology noted that older adults are more prone to these side effects due to age-related changes in gastric motility. Another concern is ginger's impact on blood sugar. For seniors with diabetes, ginger can lower blood glucose levels, which sounds positive, but can be risky when combined with medications like metformin or insulin. A 2020 study in diabetes care found that ginger's hypoglycemic effects could lead to episodes of low blood sugar, causing shakiness, confusion, or even fainting. This is critical for heart patients, as low blood sugar can strain the cardiovascular system. In short, while ginger has benefits, its side effects in older adults: low blood pressure, electrolyte imbalances, stomach irritation, and blood sugar drops require careful consideration. Next, we'll share how to use ginger safely and explore alternatives. You don't have to swear off ginger entirely, it's about using it wisely. For older adults, especially those with heart conditions, safe ginger consumption hinges on moderation, awareness, and medical guidance. Let's break down how to enjoy ginger without risking your health, plus some safer alternatives. First, what's a safe amount? Experts, including those at the National Institutes of Health, recommend sticking to 1 to 2 grams of fresh ginger daily for seniors. With heart conditions, about 1/4 to 1/2 teaspoon of grated ginger. This amount provides flavor and mild benefits without overwhelming your system. Avoid concentrated forms like ginger juice, high-dose, supplements, or powders, unless prescribed by a doctor, as these can deliver ginger rolls in amounts far exceeding safe limits. Timing matters too. To minimize digestive irritation, consume ginger with meals rather than on an empty stomach. For example, add a pinch of grated ginger to soups or teas rather than drinking potent ginger shots. This slows its absorption and reduces the risk of blood pressure or blood sugar spikes. Always consult your doctor before increasing ginger intake, especially if you're on medications like warfarin, clopidogrel, or antihypertensives. Dr. Emily Chen, a pharmacologist at Stanford Medicine, advises treat ginger like a medication. Track your intake and discuss it during your checkups, just as you would a new prescription. This is crucial for maintaining stable INR levels or blood pressure. If ginger's risks outweigh its benefits for you, consider safer alternatives. Turmeric, containing curcumin, is a well-studied option for reducing inflammation without significant blood-thinning effects at low doses under 1 gram daily. A 2022 study in Circulation found turmeric to be a heart-friendly spice when used sparingly. Chamomile tea is another excellent choice. Known for its calming effects and mild blood pressure regulation, as supported by research from the American Heart Association. Black garlic, rich in antioxidants, has also shown promise in improving circulation without disrupting clotting, per a 2021 study in Nutrition Reviews. When exploring alternatives, preparation is key. Opt for whole foods or lightly processed forms, like fresh turmeric in cooking or chamomile tea bags over high-potency extracts. And, as with ginger, start small and monitor how your body responds. The golden rule. No herb or spice is a one-size-fits-all solution. Work with your healthcare team to tailor your diet to your specific needs. In our final section, we'll wrap up with key takeaways and a call to share this vital information. When it comes to your heart health, knowledge is power. Fresh ginger, while a beloved remedy, isn't universally safe, especially for older adults on cardiovascular medications. Its ability to thin blood, lower blood pressure, or disrupt blood sugar can turn a healthy choice into a risky one if you're not careful. But with the right approach, sticking to small amounts, choosing safer alternatives like turmeric or chamomile, and always consulting your doctor, you can protect your health while enjoying the flavors you love. The science is clear. High doses of ginger, above 4 grams daily, can amplify the effects of blood thinners, antihypertensives, or diabetes medications, leading to serious complications like bleeding, hypotension, or hypoglycemia. Older adults, with their unique sensitivities, face higher risks, as confirmed by experts from the Cleveland Clinic, Mayo Clinic, and American Heart Association. Yet this isn't about fear, it's about making informed choices. Your heart deserves care that's as thoughtful as you are. For those navigating heart conditions or caring for loved ones who do, small decisions like how much ginger to use can make a big difference. The wisest path isn't following trendy health advice, but listening to your body and partnering with your healthcare team. By understanding ginger's risks and alternatives, you're taking control of your wellness in a way that's both safe and sustainable. If this information resonates with you, share this video with friends or family who might benefit, especially those managing heart conditions. A quick share could spark a conversation that keeps someone safe. And if you found this helpful, hit that subscribe button to stay updated with practical, science-backed health tips tailored for older adults. Your health journey matters, and we're here to support you every step of the way. Let's keep learning, stay cautious, and prioritize heart health together. See you in the next video.